Today I want to show you an interesting case, how I approached that case surgically, and the long-term follow-up results. So let's dive in. So this is a great case of a patient who is transitioning FTM and came for chest masculinization or top surgery. And so you can see on the before picture, this patient's very lean, very muscular, in very good shape. And my analysis is really geared towards what's the best surgery for this patient. And there's several options. There's something called keyhole, where it's a small incision at the base of the areola, where you go and just take out the breast tissue. There's something called periareolar, where it's kind of like keyhole, where you go in and take the breast tissue out, but then you extend the incision all the way around the areola to make it smaller or to move it up a little bit. And then there's double incision, which is where you just take the entire breast off, do a free nipple graft, but it leaves a little longer scar underneath the pec. And so based on this patient's chest, we opted to do the third option, which is a double mastectomy with the free nipple areolar grafts. And let me show you why. So when I first analyzed this patient, there were two things that jumped out at me as far as why I decided to do a double incision surgery. Number one is that a lot of the breast fullness was underneath the pec muscle, meaning that you can see here, this patient's pec muscle is here, but the breast is pretty low down here. And doing a keyhole in this case would leave a lot of extra skin in this lower part that I wasn't sure was gonna tighten up. And the second thing is that the nipples, which are unfortunately blurred out for social media purposes, are also below the level of the pec muscle and need to come up to about here to be appropriate. And so doing a keyhole is not going to address that, but also doing a periareolar is not going to bring the nipple up this distance. It's just not that strong of a lifting technique. And so that's why we decided to do a double incision with free nipple areolar grafts. Now, let me show you some other views as well. You can see here on the 3/4 view that this angle is about 90 degrees. So there would have been maybe a chance that the skin would tighten up, but it would also still leave the nipples way too low and below the border of the pec muscle. And then on the side view, you can see moderate sized breasts, not significantly big, but also not that small. And so the decision is, again, why I did top surgery with a double mastectomy with the free nipple graft. So here's the 1-year result, and I want to point your attention to a few things here. Number one, look at the musculature. This just looks like a very athletic male chest now. And part of that is because the pec muscle is now revealed, especially in this lower part of the pec, but also look at that incision. It's placed very nicely below the pec muscle and curves under the pec muscle all the way throughout. And you can see based on where the nipples were on the arm before, right? If I point to here versus here, you can see it's a much higher position. It's now gone up to about this position on the chest, which is a much more appropriate location for a male nipple and areolar complex. The other thing I want to highlight is you can see in the center of these areola grafts that there's been a loss of pigmentation. Now, in my experience, and I've done tons of areola grafts, typically patients who have darker skin tend to have some pigmentation loss with their areola grafts. Now, it can take up to a year to a year and a half for that to come back. And in this patient, initially after surgery, he had lost a lot of the pigmentation in the areola. And so this is actually a lot of it coming back. And I always tell patients, wait at least a year and a half before deciding to do any areolar tattooing for color, because a lot of that pigmentation can come back. But if you have darker skin and having this exact surgery, be prepared that you're likely going to lose some pigmentation, at least initially. So now let's look at the 3/4 view. And remember in the before picture how I was highlighting this angle here that the breast makes with the abdomen. And you can see now in the after, this contour is basically just following the contour of the pec, which also leads me to show that the pec now looks so much more muscular. You can see all the impact of the exercise and the hormones by removing the breast and revealing this muscular pec. But the other thing that's a little bit of a nuance is the scar position and placement kind of frames the pec and almost defines that lower border of the pec as well. And it takes a lot of skill to design these scars very accurately and symmetrically. And then finally, going to the profile, you can see now everything is deprojected. And so now instead of having this kind of shadow and this kind of fullness, the chest is now just following the contours of the pec. And so a really excellent result for this type of surgery at 1 year. So this surgery is actually very well tolerated. It's not very painful. Most patients go back to work within a week or so, and a few weeks to a month before they're out of compression and back to the gym. Final results, although you see immediate difference right away, final results usually take up to 6 months, but that incision and the pigmentation of that areola I was talking about can take up to a year and a half. So I hope this video was educational for you and showed you a little insight into how I, as a plastic surgeon, approach these cases and seeing these long-term results. And if you're interested in seeing more examples of this type of surgery, be sure to check out my website, my YouTube page, and my Instagram page. Until next time, guys.